Hi everyone, it is 8 o'clock a.m. Eastern Standard Time here, so we're going to go ahead and get started so that we are conscious of everybody's time. We have a couple of our speakers. Most of our speakers are already online, so just a quick note to them. I see that you're logged in, and as it comes time for you to be on the agenda, we're going to go ahead and unmute you. And just a quick note to Carlton, if you could give me a hand here. It seems that our buddy Rogers in Uganda is having a hard time with the link. Do you have a link handy that maybe you could send him? And so we'll work on that as we're going through. So I will officially get started. Thank you. So good morning, good afternoon, good evening. I know we're in a lot of time frames right now. It is truly my pleasure to welcome you all today. And I don't see many of our cameras on, but I see your names, and it's really nice to see those. Let me start by introducing myself. I'm Amy Ronshausen. I'm the Executive Director of Drug Free America Foundation, and I also have the honor to serve as the International President for World Federation Against Drugs. Drug Free America Foundation is a drug prevention and drug policy organization, and World Federation Against Drugs is a community of non-government organizations with the aim of working toward a drug-free world. So our world has significantly changed over the last few months. I think you all would agree with that. And the idea for this call was really to bring together global leaders to share how they've been adapting their strategies, hear their challenges, and really understand their needs. Our hope is that by laying it all out on the table, we can learn from each other and really help each other. So as we continue today and we hear from these global leaders, I really want to challenge all of you to really listen to the needs that they're going to express, and ask yourself if you're doing something in your community, in your region, in your country that you might be able to share to help our global community, because that's something that we're all in this together, and we really need to be able to share our resources. So each speaker was asked to cover about 4 points at a very short period of time, so please bear with us. So the points that each person was asked to cover are what are the impacts of COVID-19 on their area, and if they have them, just some statistics on where they're at and how their country is dealing with it. Are they under stay-at-home orders? Are businesses open? Just so we can get a general idea of what's going on. The next top issue we asked them to cover were there any gender-specific issues going on? What new strategies have they developed for their community outreach in regards to prevention, treatment, recovery, or just meeting the basic needs of their community? And then lastly, outside of financial resources, because obviously that's something that we all always need, what kind of resources would be helpful or are needed so that they can further their drug demand reduction work in this new normal of COVID-19. So a few housekeeping announcements before we get started. I'm going to lay it out there and let you know this is probably going to be a long call. There's no way around it. We have representatives from at least 15 countries who are going to speak. They've all been given a 5-minute space, and I ask that everybody please respect that time. I always want to recognize that we have several different time zones participating today. So I've tried to put those of you who are in the later time zones first, but please know that we understand that as it gets later in your time zone, it might be dinner time, it might be time to spend with family, and please jump off and do what you have to do. We understand that that comes first. The event is being recorded, so we'll make sure that we send a link out to everyone afterwards, and we'll also be sending out several resources and a post-event report. We'll unmute each speaker when it's their turn on the agenda, and if you scroll through the chat earlier on, when we first logged in, I did copy and paste the agenda so that the order of which countries would be speaking. And lastly, before we get started, I just want to ask you to bear with us. Many of us travel a lot, and we've been on planes, and you hear a pilot come on and he makes the announcement that there's going to be some turbulence ahead. because you were prepared and you knew that it was coming, the turbulence really didn't seem as bad as it would have been if you hadn't known about it and there was radio silence from the pilot. So friends, this is your pilot, and we are probably going to have some turbulence today in the way of technical difficulties. We have, more speakers than I've ever seen on a webinar to date. And so we're going to be muting and unmuting. For that reason, we've asked them to just do it in a conversation manner so that we didn't have to share screens with 18 different people because we figured that that would be really difficult. And to help us through our ride today, we have our Drug Free America Foundation Program Manager, Chantel, who is working behind the scenes to help us with our logistics and web stuff. And I'm very happy to have my good friend and co-pilot Carlton Hall, who's going to be helping to keep us on track. And then also he's going to have some fun activities and questions that he's going to pose to you throughout the webinar, just to make sure that we're awake, but also to make sure that we're capturing the information that you want to hear today. So Carlton, I will turn it over to you before we go on with our first speaker. Wait, I can't hear you.
Absolutely. Well, welcome everyone. It's an honor to be here and to be a part of this. Looking forward to the conversation. I'm not going to take up much of your time. The role that I want to play today is that of helping us to be engaged in this conversation while we're hearing from these remarkable leaders from across the various countries delivering kind of what's happening for them. And so to manage some of the turbulence that Amy spoke to, I want to inject maybe a little bit of fun as we're doing this. We'll also have some serious questions as well as we go through this, and an opportunity for all of you to provide your questions. So as you come up with questions, please put them in the chat box so that we can capture them and make sure that we're able to address them as we move forward. For those who are going to be presenting, my apologies ahead of time, but I want to share with you, Amy, I'm not able to share my screen. You have to do something to allow me to share my screen. There you go. Okay. All right. So, Amy, why don't we go ahead and go to our first presenter. We will be coming back to you with questions that we will pose to our audience and allow us to engage in this conversation. All right. So Amy, if we go to our first presenter, and then we'll come back with some of the questions and some of the activities that we have for everyone.
Okay. And in the meantime, I think I'm fixing the screen share. But I'm not sure. Okay, so we tried to kind of group this into countries, and also, like I said, I wanted to try to keep those of you who had the latest time zones toward the front, but then also anybody who had some special reasons why they had to jump off. So for that reason, our first speaker is going to be Linda from Sweden. Linda is the World Federation Against Drugs Secretary, and she's the board member representing Europe. So Linda, I believe I have unmuted you.
That is correct. I hope you can hear me. Can you do that?
I can hear you, yes.
Perfect. Well, thank you very much. First, I would like to say that I am extremely thrilled to be on this call, because I think a lot of us have the same challenges that we see as a consequence of the COVID-19 that we all are facing. And I will try to describe some of the challenges that we see here, and hand over a couple of questions that are on my mind in the end, and hopefully we can all help each other to go a bit further here. I think Sweden has been quite famous in our strategy to sort of counteract the coronaviruses. We have never been in a complete lockdown, which I think is quite unusual. However, we have a lot of restrictions. The businesses have been open the whole time, but we also have encouraged all people working from home. So a lot of us have been working from home since March. Universities and high schools have been closed. Other schools has been open the whole time. We can also see a lot of things happening right now that we know from before impacts the drug situation. The unemployment is increasing. We see some social unrest right now, although that is kind of common that we see an increase in that in this area of the year or this time of the year right now. We are not allowed to gather more than 50 people right now. In forms of statistics, we see, if we compare May 19 to May 20, we see an increase of crime connected to illicit drugs. There was an earlier concern maybe that we will have a lack of drugs on our black market, which we thought we saw tendencies of in the beginning of the corona crisis when the prices went up. However, it seems like the drugs are finding the way into our streets right now. So it doesn't seem that we have any shortage of drugs anymore. We also see a decrease in burglary and theft, which is probably a consequence of people staying home much more. When it comes to cases, we have had a lot of deaths due to the COVID-19. That is particular because we had it into our elder care. And unfortunately, we had a lot of cases in there and where it become very deadly. So right now, I think we are releasing our statistics every day at 2 o'clock. So I think today we crossed the 5,000 dead, and we have around 53,000 cases. And I think you can understand that that is pretty much if we count on, if we see that we are only 10 million inhabitants of Sweden. So we have a bit concern over the consequences that we see from the social sphere of it. We are also a bit concerned, and I think we share this with a lot of countries in the world over the situation in domestic violence. What will the consequences be when people stay home in their families, when they don't have the possibility to go home? We also know that social isolation increases mental illness, and that will probably also have a lot of consequences, both in domestic violence and in use of drugs. What I don't think personally that we speak enough about is the situation for the children in these houses. There has been a lot of focus in Sweden on domestic violence, which is very good, of course. But I think we have to focus equally much on the children who also are staying home with their family much more, to make sure that we do prevention activities that can compensate some of the worrying things that can happen there. We have not seen any increase in the reporting of domestic violence. So this is a worry that we have, and I think that is also quite natural, that the increase in worrying to social services or to report to the police has not increased, because people are still at home, and you don't tend to report that when you are sort of locked in a bad situation at home. But nevertheless, the state has granted money to support organization working with women's shelter and support lines and all of that. So we have some more resources there. When it comes to what we have done in order to sort of strengthen the social support from the consequences that we see of Corona, I live in Sweden's second biggest city, and from the municipality level, we have done a lot of things. One of them is that we have new housing strategies for people who need housing and shelter. They are granted longer periods. We have special housing strategies for people who have the COVID-19, so we can isolate them. We have also granted a bit more generous support to these groups of people. Longer stays is one, and also that we don't have as rigorous demands from them. So I think we are trying to somehow compensate the lack of social support that is a consequence of what we are doing. We are also trying to keep as much as possible open in order to support. We have all the outpatient services ongoing. They have done much more work digitally, which is a great development in my opinion, because that is something that we can also gain from after the corona. We are also trying, and now I'm getting close to the challenges that I see, to have as much, to spread at least the digital support that, for example, NA and AA are doing, the Zoom meetings and other ways of gathering. It is also, Sweden is in the in the better part of the world of the year right now, because we are on summertime and the light is returning. We have warm weather, which means that we have the possibilities to be outside, which was not the case in March, for example, when it's dark and cold in Sweden. So when you talk to the civil society groups that are working with support groups, they have bigger possibilities to meet outside, to arrange activities outside. But that is also worrying for me. What will happen in the autumn when the darkness returns to Sweden and we coop up inside our apartments again? And some of I have a couple of challenges that I want to raise before I see my time is almost up. And one is the recovery support. It is, I mean, the isolation that the corona is creating is very dangerous for people in the recovery process, especially early in the recovery process. So what I am very interested in hearing is a lot of good ideas on how we can support the recovery community when we are not able to meet in person. We are trying to do it like we are doing now with webinar, but we also know that physical contact and meeting in person is extremely important. And also when it comes to prevention, we don't know a lot of things. We don't know how closing the schools will affect the prevention works. We don't know a lot of things, and we don't really know how to compensate and do more preventative efforts in this era, so to say. The schools will open, all of the schools will open probably to autumn, and there is a lot of work to be done then. And that is one area I would also like to raise. How can we build the social environment to protect and prevent when we are not allowed to gather? And then the final concern is the unemployment that comes from the financial crisis we are going into as a consequence of corona. We know that this has a huge effect on the drug situation. So that is also something that worries me in the upcoming, and I think we have to think a lot about both prevention and recovery support and treatment to be able to handle that. I think I was 7 minutes, and I'm extremely sorry for that, but that was my challenges also. So thank you.
Perfect. Thank you, Linda. I think that some of the things you touched on, I have a feeling we're going to hear back and forth between a lot of the countries. And I know that some of the challenges you raised about the recovery support, how do we build those social environment when we're not supposed to be within 6 feet of each other, and the financial crisis, I think that those are going to come up a lot. So hopefully we can learn from what some other countries are doing and be able to share some resources on that. So I think I might have figured out how to put each speaker on video if I promote them to panelists. So I'm working on that as we go. And I think our next country that is going to be represented is Bangladesh. And I would like to introduce you to Iqbal Masood, who is the Director of Health Sector for Dhaka Asylum Mission. I might not have pronounced that right, so please correct me. And we will give you the floor, sir. And I've unmuted you. You might have to unmute yourself as well.
Okay.
Okay.
Are you hear me?
Yep, we can.
Okay. I'm really so pleased to see many colleagues and professionals and friends from the different countries. And thanks to organizers, especially Amy, for giving me the chance to speak to all. Thank you very much. Let me little bit explain about the Bangladesh situation on COVID-19. As of today, 17 June, according to our health ministry statistics, there are 3,489 confirmed COVID cases in Bangladesh, and including 1,305 related deaths. And the country confirmed the first COVID-19 case in 7th March. And still now, and March and April, our whole country was locked down. But now gradually our country and office and business center are opening, but still schools are closed, and at present country is divided in three zones: red zone, yellow zone, and green zone. Red zone is completely locked down, under lockdown, and yellow zone some part of lockdown, and some part are open, and green zone is okay. And this time we are passing very high, we call this a peak time for Bangladesh, and not only Bangladesh, the South Asian countries. So today is almost 50 deaths, and more than 2,000 COVID positive case today. So we are passing a very difficult time. And sometimes we work from home, and sometimes we need to go office and our hospitals, because my organization running many general hospitals, field-based hospital, community-based hospital, and at present we have 43 health center in different places in Bangladesh. So we have to provide logistic supports and PPE and others equipment to prevent. And our doctors are still, they are fine, but in Bangladesh, not our doctor, is almost 40 doctors is already died, and two ministers, one ministers and two parliament members has died due to COVID-19 last week. So we are in Bangladesh is very panicked. But our poor people, due to our so many disadvantaged people in Bangladesh, day laborers, that's why our government is open some markets and some offices, and our garments workers, although they are working, and our NGOs, civil society are working from the home. Sometimes we need to go in the field. So this is the situation, and our health system is very not updated like Europe and America. It's very limited health services. Especially we have limited ventilator, ICU, and oxygen support. So it is very critical, and sometimes many patients die without treatment, and they are not getting admission due to limited seats and limited ventilator and ICU. So it is another stressful time for us. If I affected and COVID-19 positive, we will not any treatment services from government and private. And private service is also very limited. Overall, Bangladesh situation is that, and now I am once telling about the SUD related services. And from the lockdown March, our SUD treatment center, drug addiction treatment and rehabilitation center, very few patients are admitted that time, but now we are also opening our centers, because due to limited patient, maximum service are and under challenge, because we have no external support from the government and other countries. So we have to survive with the support of the client's fee. So if don't we get the client's fee, we will not pay to our staffs, and will not pay survive. That's why with the challenge, some drug treatment center are taking admission, but and other the family support program and aftercare services also stopped, and many centers are very limitedly providing their services. And drug prevention program also we are not adequately is providing due to social distance, and we now are depending on the social media and online communication. And at present, more than 350 drug treatment center and rehabilitation center in Bangladesh, licensed center, and they are facing almost all same challenges. And as my organization is a leading organization, is one of the biggest organization in Bangladesh, is founded in 1958, And we have so many institutions with the collaboration with the different organizations. We are trying to contribute some our society. I am giving some example. We have already conducted training for the drug treatment and rehabilitation centers already. For 75% already received online training for the drug rehab and how to treat them in the pandemic situation. We have provided some PPE to 58 drug treatment center. We have provided PPE support, 2 sets of gown and 1 infrared thermometer we have provided. And at today, 56 rehab center is received support from our organization. And we are conducting social media campaigns, and already we have conducted 2 regional dialogues with the South Asian country, Asian country. We are sharing exchange program, and next program will be held on 22nd June. And one of the speaker of AMI is the speaker. And we have developed several protocols and guidelines to fight against COVID-19, especially protocol for the drug treatment center is 2 versions. One is English and another is Bengali, our language. We have developed some guidelines for the field-based workers. And last months, we have provided some support for the prison department. There is a prison is very risky area. So we have provided 170 full set of PPE and kits and 17,000 gloves and 9,000 masks and 172 goggles and 68 infrared thermometer we have provided to the prison department with the support of the German government. I think it's a GIZ supported us to provide them. We have opened online mental health services and counseling services that free of cost. Our clinical psychologists are providing online clinical services through phone and Skype, WhatsApp call. And we are conducting some live program in Bengali and our language and also English language, developing some template for social media campaign. And we are going to conduct, already we have launched a research coping strategy and well-being in the face of COVID-19 crisis. It's a Pakistan and Bangladesh, especially Salman Shahzad from the Pakistan and me jointly conducting this study for the mental health crisis. And at present, we think we need some support, especially technical support, to run a drug treatment center and prevention program. And we learned from the Western, especially from other part of the country, how they are facing the challenges. And we also share with our colleagues and fellows and other drug treatment center. And we also need adequate logistic support, especially PPE, because we are providing very token support. But I think the pandemic will continue more than 1 year or 6-7 months. How we will survive, we don't know, but they need some supported logistic support and some technical support. And this was information from my end. We would like to thanks again just every participant and organization who are contributing to make this webinar possible, and wishing all of you success and happy and safe life ahead of you all. God bless you all, and thank you so much. Thank you very much for giving me the chance and giving me the scope to talk. Thank you, Amy.
No, thank you. Thank you for taking the time to report out. And it really seems like you are meeting some of these challenges head on, and you've been having some great successes. So I think that that's something that we can all learn from. And, you know, I understand that the challenges you still face and that we're going to need resources to help with those. But I think some of the things that you're doing there can definitely be replicated. And you mentioned Pakistan also, and I just want to quick put out there that we were going to have our dear friend from Pakistan, Aja, speak today, but she had another commitment that she had to drop off for. But in our final report, we will send something that she sent for us. So moving on to our next country to be represented, we have, oh, I gotta look at my notes here. We have with us representing Lebanon. We have Ms. Rima Turk. She is the Executive Director in International Relations for Nuestro Association. And I also have the great pleasure of serving on the WFAD board with her, and she is our representative for Asia. So I'm going to make her a panelist now. And let's see if I can find her on here. And I am unmuting her. Rima, you might, there we go. You should be unmuted.
Are you hearing me?
Yep, we can hear you, Rima.
Yes, thank you, Amy. Hello, everyone. So the Lebanese cabinet took the decision to instate a health emergency, and on March 15, 2020, the government proclaimed a state of general mobilization that called for the closure of public administrations and institutions, municipalities, autonomous utilities, universities, public and private schools, as well as nurseries. The President of the Republic invited everyone to continue their work from home in the manner that they deem appropriate, so that online education is pursued for students and work for workers, and so that institutions remain as active as possible. Although the various health sectors in Lebanon have been mobilized under the direct supervision of the Prime Minister and the Ministerial Committee for Coronavirus Prevention, the emergency plan focused on the immediate healthcare problems. On March 21st, the government tasked security forces with ensuring residents observe stay-at-home measures, and on March 26, a nighttime curfew was imposed. On April 5th, the Ministry of Interior issued measures further restricting personal travel. But Lebanon's urban poor can't afford to oblige. If we stay inside, we die from hunger. If we go out to work, we might get corona, but at least we will have money to eat, one urban resident said. When it comes for the cases overview in Lebanon today, confirmed 1,473 and recovered 875. The total deaths is 32, fortunately, and new cases 9+. So actually, after COVID-19 lockdown lifted, tense anti-government protests in Lebanon. More than 35% of Lebanese are unemployed, while poverty has soared to engulf more than 45% of the population, according to official estimates. When it comes to gender-specific impacts in Lebanon, when Lebanese women felt the threat, they were at the medical front lines as healthcare workers. But what about the repercussion of the crisis on women in general and the less privileged to be confined or get treated in particular, or those women and girls who might endure the burden of the crisis? Women who might be at an increasing risk of violence due to confinement. Why should any response include gender mainstreaming? A gendered understanding of COVID-19 highlights the multiple and interrelated levels of inequality that shape vulnerability to the infection and to the personal, social, and economic impact of the crisis. As a result, gender should be viewed as a cross-cutting issue that has implication on all aspects of the pandemic. The National Commission for Lebanese Women, the United Nations Entity for Gender Equality and Women Empowerment, the United Nations Population Fund, and the WHO are partnering to provide periodic Lebanon-specific gender and COVID-19 alerts throughout the public health crisis and its ensuing economic crisis. These updates aim to A, provide observations from frontline responders on issues of gender equality in Lebanon. B, compile available secondary data on these issues into one reference point. C, consolidate guidance and programmatic tools related to gender issues. And D, offer recommendation to support a more gender equitable response. In COVID-19, NGOs faced many challenges. Projects and programs were put on hold, to be restructured, delayed, or simply canceled due to lack of capacity to implement or change of community needs. Rapidly increasing cost of items, thus increasing project expenses beyond what budgeting for. Meeting became all online, which reduces the level of interaction, accessibility, and accuracy. The focus changed to the main causes: health, physical and mental, food, and gender-based violence. New strategies have developed for community outreach in regards to COVID-19 prevention, hygiene, policies, brochures, and in regard to treatment, COVID-19 testing, insurance, and equipment and material like masks, sanitizers, and gloves. Also, as a new strategy was the food production, sharing awareness about house and local farming, and the food donation as packages, basic needs delivery, prepaid coupons, and cash for food. While the focus on gender-based violence was through awareness on social media, TV spots, SMS, and through legal counseling services, psychosocial support, and marriage counseling. When it comes for the last point, the COVID-19 restriction have already led to a disruption in the availability of drugs in Lebanon and to an increase in prices. It may reduce consumption and it causes drug users to seek substitutes, which are often more harmful. The focus on the increasing prevention strategy would be helpful to further the drug demand reduction work in the era of COVID-19. To conclude, Lebanon is battling interconnected monetary, economic, and fiscal crises, rendering many jobless and hindering the import of vital goods, including medical supplies. The COVID-19 crisis is now further crashing the economy. Prospects for additional aid are complicated by the fact that the international community is similarly reeling from a health pandemic. For many Lebanese, the future is bleak. Thank you so much.
Thank you, Rima. Thank you for that great report. And thank you especially for including the gender issues and that perspective, because that's something we want to make sure that we're always looking at and thinking about. I really appreciate it. And it's wonderful to see your face. I think I figured out the video now. So next up, we have Turkey, and I'm going to promote Ergin as a panelist. And Ergin Bersin is from the Turkish Green Crescent. He's the Foreign Relations Department Manager, and he is also the Secretary of the Vienna NGO Committee. So I'm unmuting him, and then I'm asking him to start his video as well. So Ergin, you're on, and we see you.
Thank you, dear Remy. How are you?
Good, good. Thank you for being
Thank you very much. So I'm starting as I have 5 minutes. Hello to everyone. I can summarize the situation in Turkey as we were a bit lucky in the beginning and we had a chance to see Italy and Spain experience. So we were around 2 weeks after the Europe. And for this experience, we focused on preparing ourselves to the situation. We focused on hospitals' capacities. We act fast, and now we are trying to adapt ourselves to the new normal where we are all together in this. Today, I'm going to tell you about the current situation in Turkey and how the government, the community, and the business reacted to COVID-19. I would like to start with some recent numbers. The total number of positive cases in Turkey is more than 108,000, and the total number of deaths is 4,800. The case fatality rate is 2.67, which is less than the overall CFR of the world, because we have much more younger population, and compared to Turkey's population, 57 people out of 1 million have been lost their lives so far. So the first case in Turkey confirmed in March 11, which was the same day that the WHO declared the disease as a global pandemic. So first of all, we closed our borders, but only for commercial purposes. They are still reopened. On March 16, after March 16, we started our whole education system from primary school to universities online, and this has affected millions of students. And also at the same days, the workplaces temporarily suspended, which includes theaters, cinemas, exhibition centers, concert halls, restaurants, cafes, so on. And also at the same day, the football, basketball, and the other sports leagues have been postponed. And a curfew was imposed on those aged 65 and over and aged 20 and younger. And the companies, other than those involved in industrial production and public institutions and organizations, has switched to a remote working at home at that time. All entrances and exits from provinces of 30 metropolitan areas have been closed. And finally, a partial curfew has been imposed at the weekends, including the entire public holidays for more than 30 metropolitan areas. So this semi-lockdown has been continued for 1.5 months, and people try to learn how to work from home and how to adapt the social distancing to their lives. And after 1.5 months, and starting with the 1st of June, reopening of cafes, restaurants, shopping malls started. Working from home changed to semi-working from home. For example, in Green Crescent, the managers are coming 3 days and the other colleagues are coming at least 1 day to the office right now. So although it is better to work from home, but at the same time we try to adapt ourselves to the new normal. And but the social distancing is still the most important thing in the country. And we try to not to use the public transport very much. In this process, at the beginning of the situation, when we see the examples from Italy and Spain, we focused on our hospital systems and we innovate new breath ventilation units for the hospitals. The government stopped the selling of the masks and distributed free masks to everyone every week. You could order online and you could have them from the pharmacies. And we also had a chance, because we had much more masks and we had ventilation units. We sent around 60 countries with planes some medical aid. And when it comes to crime, we see that there is a decrease in crime issues. However, violence in the family increased somehow, and absolutely it affected the gender-related violence too. On drugs, there weren't any regulation implementation changes in drug policies during COVID-19 outbreak. However, as the borders closed, this will affect the drug supply, and it also may affect the usage behavior. And actually, we are afraid about when we open the borders, how the users will reflect to that. When it comes to what we do in Green Crescent, we were very fast and proactive after CND meeting. When we returned back, we started from home. In our, we are 440 people here, and 300 persons are located in our consultancy centers. Our consultancy centers transferred their business to online, and our learners are reaching from there. In addition, we had focused on tobacco usage because it's very dangerous for the COVID situation. And we also focused on screen online addictions. we have campaigns for quitting tobacco products. Also, we have campaigns for limiting the screen usage. These campaigns turn to 8 languages and sent to more than 70 countries around the world, so they are going all at the same time. Finally, we have prepared a questionnaire by our experts for analyzing the situation of drug and alcohol users. And this questionnaire has been answered by our learners who are following our programs in our centers. And we also shared this questionnaire with many countries to understand the situation in their countries too. After the study finalized, we will share the report of the situation of alcohol and drug usage around the world with our colleagues in FAD. As Linda mentioned, actually we do not know the long run. We will see and we try to adapt. Thank you very much.
Thank you, Ergin. We'll look forward to hearing about that report. That sounds like that'll be really amazing to see, especially if you were able to share that with other countries. And thank you so much for the great work that the Turkish Green Crescent does around the world and what you're doing there. It's really amazing. Thank you.
Thanks so much, Amy. Thank you very much.
Okay, we are going to see if we can get Carlton's screen shared again. So Carlton, I'm going to unmute you. You'll have to unmute yourself as well, I think.
Got it. Can you hear me?
I can.
Terrific, terrific. And I add my thanks to Amy's. These were remarkable presentations. Thank you so much. A wealth of information, and it appears and sounds as if while COVID is experienced by everyone, not everyone is experiencing it equally. That there are indeed some populations that are more vulnerable than others. And so it's really incredible to hear how you all are addressing this. What I would like to do is ask and engage our broader community in this conversation. And so part of what it is that I'm asking everyone is, if you wouldn't mind, put in the chat box the first question that you see there, your answer to it. How does COVID-19 further impact your SUD challenges and priorities in your communities? We're very interested in hearing from everyone kind of what's going on for you all as we're listening to our panelists. What's happening for you? So if you put it in the chat box, we'll be able to read and see what's going on for those of you who are participating in the webinar. How has COVID-19 further impacted the SUD challenges and priorities in your community? What's going on for you? Some of you have already started doing that. Chantel, do you have anyone that's sharing now?
Yes, we have, I believe the name is Crispine from, let's see, from Kenya.
From Kenya, yes.
Yes, from sharing that many teenagers have become pregnant during this crisis. And they've decided to run an online campaign targeting teenagers. However, many cannot consume the online services due to high poverty levels, plus loss of jobs for their parents. So she's wondering, how can we come up with the appropriate and child-friendly products to help us safeguard the teenager as to curb the increasing numbers of teenage pregnancies?
Got it, got it, got it, got it. Any others that were shared? There's a lot going on.
That was the only one that's come up so far. Another one from Kenya, working in the slums and children connected to the streets. How can we address the issues of children connected to the streets during this crisis when most of them are addicted to drugs?
Understood. Understood. A lot's going on. A lot's going on. Incredibly difficult to reach people via these virtual platforms that are required now. I'm seeing from Stephanie, folks may be active on social media, but it's not a great way of reaching them. Excellent, excellent. So a lot's happening, Amy, and I think we're going to learn more because I believe we may be going to Africa next. Right?
We are, and I think so some of these questions might be answered for some of our panelists, And then some of them we might not be able to answer today here because unfortunately we don't have all the answers. But what we will do and what we promise to do is the questions and the needs that we can't address on this webinar, we're going to make sure that we take notes to those, and we are going to do some research for you and reach out to other experts that we know that might not be on today's panel and try to get you some of the answers that you're seeking. So we have heard today so far from Sweden, Bangladesh, Lebanon, and Turkey. And now we are going to move on to Africa, and we will have a speaker from Uganda. Then we have 2 speakers from Kenya. We'll have Nigeria and then South Africa. So first up is Uganda. So I'm going to now promote Rogers to a panelist. And Rogers is the executive director of the Uganda Youth Development Link, and he is also the vice president of World Federation Against Drugs. So I see Rogers. I have unmuted him, and I think you still might be muted on your end, Rogers. There you go.
Hello. Okay. Thank you very much. I'm excited that I'm meeting my friend virtually. Normally we do meet around this time. Of course, COVID everywhere. And when it comes to countries in Africa, which are poorly resourced, which don't have a complete health system, and where welfare issues belong to individuals, not to government, it's a little bit challenging. It's a little challenging. And African populations are young. We are talking about young population, and my country is also a young population. Of course, when COVID came, for us, it took us unaware. People were not so bothered until government came in with the full force, and we have experienced a full lockdown, 72 days. Now we see a partial opening up, but things are not yet all well, because in my country we have 52 ICU. So barely nothing out of 40 million. I mean, but also they're estimating that because of the negative impact of COVID, many people are likely to fall into poverty. We are likely to see another 3 million people in addition to the 23 who are going to become, who are going to fall into poverty. And that's going to be very challenging. Of course, what happened is that we had to close all our drop-in centers, our safe space. Every activity was grounded. We couldn't do much. Also, what we saw in terms of young people in the slums, everybody was told not to move, stay at home, curfew, lockdown, don't move, stay at home. And most of the urban people can't manage. Of course, we have a lot of food in the rural area, but in urban centers, this came with a lot of disruption. Work was disrupted, job losses. We also saw a decline in employment, no access to money. And this was very, very much. People have never experienced this before because this disrupted consumption patterns. And we began to show an increase in mental health.
Oh, looks like
I went off.
Oh, you're back now.
Okay. Let me catch up with where I was. We saw young people's work disrupted, and once work is disrupted, this comes with a lot of other challenges. We saw a spike in alcohol consumption among young people, not the distilled beers, but with this local produced generated alcohol. We also saw an increase in gender-based violence. And even children started learning away from home, because when children are sent away from schools, when children are in homes and cannot move, things become a little bit difficult. Because here, for us here, we are social people. We move everywhere. We don't call you that we are coming. We just come and bump in and say hello. And all these were disrupted. So school closure, the closing of our facilities, our drop-in centers came with a lot of challenge. We saw a spike in alcohol drinking. We saw a spike in marijuana and consumption of drugs. We saw a spike in gender-based violence. We also saw, because the idleness came with a lot of challenges. People are not allowed to gather together. There was a lot of enforcement And this was, you know, with a lot of high-handedness from the police and the other law security organs, because they didn't want people to move. Here, people, you have to, you know, to use a lot of force in order for them to do what. Now, also we saw families getting challenged with food. And families which have girls have been encouraging them to go and you know, sleep with other people. We saw a lot of sexual exploitation, which led to problems because people had to look for food. And once they go out there, they get access to exploiters. And this was what was very bad. And so what have we done as our strategies? One, we have intensified messages on alcohol awareness. And that alcohol cannot, you know, solve all the problems. But also we've been working with governments, the National Task Force on COVID, to see that the issue of drugs, the issue of alcohol is given attention and is addressed. Of course, there was closing of bars and also discouraging people to buy alcohol and take home. But also we've been able to support with food distribution, along with government, but also we've mobilized a lot of resources so that our young people in the slums who are homeless, who are sleeping in single rooms, who don't have access to jobs are able to cope, because food has been a very challenge. And most of our young people are found on the borderline, food borderline. Actually, if we don't intervene, the things will not be what? The situation will not be good. But also in addition to that, we did some cash transfers, thanks to our NGOs which have supported us to do some of this work. IOGT supported us, Oak Foundation supported us, Lutheran World Federation supported us. Now, long term, what are we looking at? We are looking at some of the things we can do. Of course, it has been very difficult to access people who are using alcohol, who are using drugs, apart from having radio and TV awareness. But also what we have done is that we've been talking to our social workers through Zooms and what to find a way how they can intervene and try to help these people. So that apart from the short-term measures to do with food and to do with the cash transfers, what else can we do to improve their welfare? We are looking at things like where we are going to teach them how to do short-term skills so that they can able to survive and earn income. Because all the enterprises collapse. They ate the capital, they have no money. And the other thing we are looking at is that we want people to increase their report and go for health services so that those who have substance and alcohol problems can be assisted. In the long term, we hope that the centers will open and we expect to receive more young people because the needs, the challenges are still great, and we hope we'll be able to do. What I've done is to share, I'll share with Emmy our report so that you can share with others. There are many, many things we have done, posters, materials, sending out SMS messages, all those have been captured in the report which my colleagues can share. Thank you very much for this opportunity, and also my colleagues, and also to see some of you on the Zoom meeting. Thank you so much.
Thank you, Rogers. Thank you very much. And yes, I do have a report that I'll make sure that I send out to all the participants that you provided. And I think that in this section especially, we're going to hear a lot from some of our global partners here on, you know, a new way to look at drug prevention, because here we're so used to doing the same thing. We're used to doing drug education. We're used to doing our prevention techniques. But in a crisis like this, prevention, we need to think outside the box. And sometimes drug prevention means providing food, providing shelters, and making sure that we're, you know, meeting those basic needs, because we can't just do our regular prevention work. So I'm interested to hear, and I'm thankful for the work that you're doing, and hear from others on that, because there are even some areas here in the US where there's communities that are at very high risk, and our prevention leaders are having to adapt and do what some of you guys are doing there. So it's very inspiring for us to hear your success stories.
Thank you so much.
You're welcome. Thank you. Now I'm going to promote George as a panelist. So we have George. He's the executive director of the Slum Child Foundation in Kenya, and we are happy to have him. And then we'll have a second speaker from Kenya as well. So George, it looks like you're unmuted and we see you on video, so you're good to go.
Thank you, Emmy, for the opportunity, and to all my friends all over the world. I am very much humbled. Don't worry, you know, we are used to the mask every now and then. If you don't wear one, you'll be arrested. So thank you for the opportunity to make a presentation from this other end. I hope I am visible enough to be seen. Sorry, yeah, I'm trying to put things in order. Yeah. So from the Kenyan point of view on issues related to COVID has made a lot of things to hang, which has resulted to a number of effects. A lot of people are no longer going, a lot of young people are no longer going to school. A lot of people are no longer, a lot of children are at home loitering left, right, and center. And this has brought a lot of problems. So for example, I have like 5 points that I wanted just to go through quickly. As a result of having COVID, the effects of as a result of having COVID, especially from the slum point of view, we've had cases of increased crime among young people between the ages of 14 to 18. This is from the sources that we are trying to collect, although it's not that much formal. That is from our files. Then, sorry, I am supposed to attend another meeting on the other side, so I have to lower the volume. So we've been having increased crime among young people, and over the last, I think 3 weeks ago, we had someone who was stabbed by the young people. He was going to work at around 5 in the morning and he was stabbed. The reason being that he didn't have anything to put on the table for these young people who wanted money from him. So they had to drag him and stab him. And this they're doing as a result of they don't have something to put on the table as a meal at the end of the day. Through our organization and different partners, we've been able to support around 2,480 households with food hampers. Again, as a result of COVID, we've been having cases of defilement because children are all over. Parents have to go and look for something to eat. 4 weeks ago, we rescued a case of three children. One was age 8, the other one was 5 and 3 years. And the parent had to go and look for something. And to our surprise, the uncle was the one who defiled them. We are still following up on the case, but if you look keenly, the children were at home and there was no one to, an adult to look after them. And being that the parent had to go and look for something, the uncle took advantage of them, young girls. Then we've also had cases of increased drug use. Even people who were at the initial, can I call it, testing stages, have been forced to now get into it fully because 1, the drugs are accessible, 2, the drugs are very cheap because everyone wants to sell so that they can get a catch. They can get something that they can put on the table. We are really trying our level best to sensitize the young people. When we go for the distribution of food or when we have anything within the community, we try and tell them what they need to do. We've had, like today in the morning, I had a case of a girl who had no option. She has three children and she's forced to go to a drug den just to sit there and ask for as small as $1 or $2 so that she can have something to put on the table for the kids. Apart from that, we've also had cases of increased domestic violence, gender-based violence within the families, whereby you realize that if the husband goes out, he does not come back with something. It becomes a big problem. And that is where the quarrel starts in between. The husband is on high note, he's high, and the wife is also high. You went out, you did not bring something. So what are we eating? Then that brings violence within the family. Then we've had cases whereby police are telling us, from the police from the surrounding environment, that a lot of the young people that they've arrested, if given chance, they are telling you we were doing this for the sake of survival. But if if they're given an opportunity to come back to the community, they would tell you, I would prefer to stay in the prison because I'll get something at the end of the day. Then apart from that, they're no longer willing to go back to school. They are telling you, I would prefer to go to a vocational training school, and that is it. So out of that, we've been able to, as I said, we've done cash transfers to close to 2,000 families within the slum setup. We've done food donation, and we are in the process of looking at how we can do business recovery to some of our beneficiaries. We have a partner willing to support, to inject some small amount of cash to help them recover their businesses. Yeah, so, but we are really trying our level best to ensure that things are okay. As much as it will, we are not so certain that when it will be, but still, all the 5 that I've mentioned are on the rise, and each and every new day, you heard of new cases. So it has become a problem. We are working with the police. We are working with our social workers to ensure that what we are able to do, what we can do to rescue and help our families. So I think that is it from my end, and I'm happy to join and also learn from different people from around the globe. Thank you very much.
Thank you, George. Thank you for shedding a light on, some of the serious things that are happening there. And, if we had a George everywhere, our world would be such a better place. Thank you so much for everything you do, George. And we hope that we can continue to support all your amazing efforts.
And thank you, just a quick one, and thank you to each and every friend that I've reached to.
And I think we might have lost George there. Why he
Madam
was...
President, lack of better word, you've been able to help us reach a few families, and the friends who are also in the meeting today. With the small that you've been able to give to us, you've been able to help a lot of families in the slum setup. So thank you very much.
Thank you, George. And then also from Kenya today, we are pleased to welcome Judy Twila. She is the Manager of Counseling and Rehabilitation for the National Authority of the Campaign Against Alcohol and Drug Use, NACADA, there in Kenya. So I'm going to promote her to a panelist. And if I can... Okay, I'm unmuting her.
Hi, everyone.
Hi, great. Thank you for joining us. We're all set.
Thank you, Amy. Thank you, everyone, for this opportunity. I'll begin by giving a short background of COVID in our nation. My colleague, George, has given a lot of information about what's happened, the situation is in Kenya. But I thought it was important for me to mention the figures. As we speak right now, today, we have 4,044 persons confirmed positive to COVID, and 105 persons have died out of COVID. In the month of March, the government of Kenya gave a directive that they control the movement from, especially within the city, because they realized that in Nairobi city and Mombasa city, those 2 cities were classified as hotspots of COVID. So they closed down. You could not access Mombasa or Nairobi. And in the month of April, they closed Mombasa, Kwale, Nairobi, Kiambu. So you cannot actually move from one county to another county, because they realized that, as initially thought of, most people thought that people were traveling out of the country are the one who are bringing the virus into the country. But then they realized that the virus has become a community infectious disease. So they realized, they came up with some guidelines to control the infections. And they closed all the bars, all the liquor selling outlets were closed down. And that doesn't mean that people have not been buying beer. And this has taken another direction whereby people are ordering for beers online, meaning that now we have more alcohol available in our homes. Remember, the schools were closed in the month of March. So you're bringing alcohol to a home that has children. Some of them are very, very young. Some parents have reached out to me saying that their children have taken alcohols that they have put in their own fridges in their home. So you see, it's like the kids are now experimenting with alcoholic drinks, which is very dangerous. And then GBV has risen because most spouses have lost jobs. And you know, most Kenyans are middle class citizens, so they don't earn so much money per day. And if one spouse or two spouses have lost their job, you know what that means. They cannot pay for rent, they cannot pay for food, you know, things that are very basic, even like sanitary towels have been a challenge among some of the vulnerable populations. Statistics are showing that more males are getting infected with COVID than females, meaning that the manpower, you know, the workforce is being affected because, you know, most Kenyans who are of average income depend on casual work. No, there's a construction of a house, they can carry cement, they can carry bricks and get an earning. So if they're the ones who are more affected with COVID, it means that there's no enough income for the family. And we have seen child labor is rising because if a dad has lost a job, at a regular income, it means that they have to push the whole family to go out and bring something for the, you know, to eat, or even to get rent. We have also realized that homicides have risen, husbands killing their wives or wives killing their husband, or even wives killing, mothers killing their children because life has become unbearable. You cannot borrow. Who are you borrowing from? I'm also struggling, you know? So it is a very tough situation. And I would really want to go to the area that I'm very passionate about, persons with substance use disorders. It has been very difficult for them, especially those who are homeless. They've lost their casual jobs. They don't have a source of income. And you know, like now it's like their vulnerability has doubled, you know, because the government of Kenya is also depending on donations and donor funds to support or to contain this virus. So it's like the persons with substance use disorders are no longer the only vulnerable population. So the needs are high and the demand is equally high. So you see, it's like sharing a small cake among many children. So you end up forgetting children who are not able to raise their voices. And then for us as a government parastatal, we faced challenges in training addiction professionals because we have controlled numbers. We've controlled multitude. So if I was supposed to train 360 community health workers, I cannot train them. I can only develop a training curriculum and content and send them. So the impact is actually very little. So like I would want to do role play with them, help them learn how they can do counseling roles or take up a client role. It's no longer possible. We have very small resources to be divided among many treatment facilities and methadone clinics. So as a government institution, we've been able to give very small, very small donations of PPEs and sanitary towels, and of importance is helping the treatment centers to learn about infectious diseases control, and like I would earlier I would go visit the rehab facilities. Now I am controlled. I can only do that with a lot of care and with a lot of guidance from the Ministry of Health, because I'm also worried about my own safety and the safety of my children, and also the safety of the colleagues I work with. I'm also very much concerned about relapse. Relapse cases have gone high because initially we used to have support groups whereby people would meet, AA and Alcoholic Anonymous groups or narcotic groups where they could sit and support each other. But right now, we do not have physical meetings. And some of those people may not have access to internet, so you're not able to do teleconferencing or even telecounseling or telesupport. Some of them now, once they are discharged from the rehabilitation centers, you do not know how to access them because maybe they come from areas where there is no internet connection. So there's so much anxiety about recovery, and I think there's an earlier panelist who spoke about that. I think if we would get resources to enhance ICT so that we go like train through virtual trainings or through webinars, I think we will be able to achieve what we intended to achieve, and also support teleconferencing to make sure follow-up and aftercare is done as required. I'm also worried about mental health, not only for our clients who are struggling with substance use disorders, but also for the professionals. You see, people are so much anxious. Nobody knows what will happen tomorrow. Our children are with us in the houses. They are so anxious. They don't know if they will repeat the same class next financial year, or will they go to the next, there's so much anxiety. And I think we are all submerged into thinking about COVID and the outcome of COVID. And we are wondering, is this the new normal, like will we live with COVID or will it come to an end? So like us as NACADA, we are currently planning for the next financial year activities. And we have two planning strategies. If COVID stays with us, how will we be able to achieve our targets? And if COVID goes, how will we? So you see, it is anxieties. Even me as a helper, I am worried. You see, I need to get somebody to reach out to, and the other person is also worried about their children. Today we are reading in Kenya news that one of our counties, since COVID began, they have over almost 4,000 early pregnancies among children. So that means our children are home. We are struggling to put bread on the table, and they are busy, in engaging in irresponsible sexual activities. So there's so much, we really need to reach out to each other and just support one another. It is not an easy situation, but we will overcome. Thank you very much for the time.
Thank you so much, Judy. Thank you for bringing up some of that stuff. And I think that we definitely can help and find some resources for the virtual training needs that you're talking about. That's one good thing I heard when you said that, oh yes, this is something we might have an answer to. So we will definitely be in touch with that and put you in touch with some partners. And I think that a lot of the things that you expressed, we're all feeling, and I can certainly share your anxiety. I am suffering from that myself. It's just, it's sometimes breathtaking. It just takes your breath away when you think of what the different communities are going through and how we struggle to meet those needs. So we're very thankful for partners like you who are out there and making those things happen. So thank you very much for joining us today. Sticking with Africa, we have our next speaker is from Nigeria. So I'm going to move him to a panelist. And I would like to welcome Dr. Martin Agwowi, which I'm probably pronouncing wrong. So I'll ask him to fix that for me. He is the founder and executive director of the Global Institute on Substance Abuse. And he is the national president for the Untitled Chapter in Nigeria. So let me find him on here.
Thank you very much, Amy. Can you hear me?
I can hear you and see you, so you're good to go.
Oh, good. It is my pleasure to share experience from Nigeria. Once again, thank you, Amy, and thanks to all my friends across the globe. Thank you. Rogers has given a brief background about some kind of peculiarities of African countries, and for the benefit of the global participants, Nigeria is one of the 55 countries in Africa, the most populous country in Africa, and the 7th in the world. Approximately 200 million people with 36 states, including the Federal Capital Territory. Of course, it has one of the youth and adults, young adult population with about 70% of the population less than 29 years of age. So let's talk about COVID-19. The first COVID-19 case was recorded in Nigeria in February, precisely February 27th, 2020. And officially, as it stands today, all the states in Nigeria have recorded COVID-19 except one state. As at yesterday, being the 16th of June 2020, Nigeria has recorded 17,148 cases and has successfully treated 5,623. And of course, there are more male than female that have contracted COVID-19 in Nigeria, approximately 70% male. And unfortunately, Nigeria has lost 455 persons as at yesterday to COVID-19. And we had the highest number yesterday with 31 fatality. So active cases stood at 11,068. So deaths are mostly those of advanced age. Records tells us that those above the age of 60 and possibly with underlying ailments like the diabetes, high blood pressure, asthma, and so on. So the death rate, which is put at about 2.6%, may not be unconnected to the young population of Nigeria, because less than 30% are of the age above 30-something. So that also tells us that the young age may not be totally out of it, even though we cannot be very sure. So most parts of the country is on lockdown. Most people now work from home. And of course, it is affecting different settings. So briefly, let me look at 4 settings. The health, for example. The health condition, the COVID-19 has complicated the fragile health status in Nigeria, the health system. Of course, with limited infrastructure, inadequate healthcare personnel, and to compound the situations, some medical staff, an association, part of the medical association, are on nationwide strike as I speak with you today. So that is already complicating issues, and we just hope that their needs are attended to almost immediately. And of course, inadequate personal protective equipment for the frontline healthcare providers. And of course, education. The school system from primary to the tertiary level is on total lockdown. And of course, relying on e-learning, but considering the challenge in Nigeria as one of the developing countries in the world, not many people have access to these online facilities. So it is really a difficult time. So one cannot be sure too of when schools are going to reopen for academic activities that we are used to. Briefly on economy, of course, there is a drop in national income to about $2.7 billion in the first quarter of this year, talking of 2.7 billion US dollars. That's a lot of money to Nigeria. And Nigerian naira has, against the dollar has depreciated to up to 15% since the pandemic. And there is rising inflation to as much as 12.34%. Of course, foreign trade has dropped to as much as 18%, and many have lost their job, and most also are on half salary since the beginning of the pandemic. And of course, security. The loss of job uncertainty has also compounded the security situation in Nigeria. and there have been increase in cases of rape in Nigeria and in some cases incest. So there are concerns talking about the school system, talking about those in drug system, treatment and prevention. It's been a very difficult time to do that now. We are concerned about the mental health due to lockdown, isolation, and so on. But we are also trying to support government and other institutions to provide some kind of palliative, to support those who are in need and the less privileged. And one of the ways we want to go now is to go online in terms of delivering the universal prevention curriculum through the online facility. Of course, this will also require some kind of support. So because of time, so let me leave it at that and say once again, thank you for this opportunity to share briefly what we are doing in Nigeria. It's my pleasure.
Thank you so much, Martin. It was great to hear from you and see you.
The pleasure is mine.
Thank you. Next, we have South Africa, and then we will move to our break. But I do want to throw something out there to our participants because we skipped India earlier on. So if Dr. Rajesh Kumar or his colleague is on, please put that in the chat message of the person that's representing so that we can circle back to India before we leave. So next I am promoting Stacy as a panelist, and Stacy is joining us from South Africa. She is the Chief Executive Officer of STAND, and she is the Vice Chair of the Western Cape Street Children's Forum. So let me make sure that we're on here. Let me find her. Right, there we go. I see.
Hi.
Thank you. We see you.
Can you hear me?
Yes, you're good to go.
Wonderful, wonderful. Hi, everybody, and thank you so much for the invitation for South Africa to speak. And I think I pretty much reiterate, or we do certainly, what's happening globally. So what I thought I'd do is just give you a couple of, just in terms of the pandemic, where we're at, and then really focus on the SUD side of things, a few challenges, and then really to go into what we've actually been able to achieve, because I think that's a really exciting aspect. So South Africa, so right down there, southern tip of Africa, we have a population of about 58.7 million. Our current positives are 76,334. We've had just over 42,000 recoveries and 1,625 deaths. The Western Cape, which is the part that we're from, Chantal and I, right down there at the tip, we are considered the epicenter of the virus at the moment, which is 45,357 cases. So, if you look at the, comparative to the country, with 1,200 deaths and just over 30,000 recoveries. But we're looking now, we're bracing for the storm, essentially, because we're going into winter. And just everything you look at tells us that we're looking at between sort of 40 to 48,000 lives being claimed still this year, which is it's a saddening fact, but that is the reality. So in terms of our lockdown, we've pretty much been in lockdown, I think, one of the longest countries in lockdown. So we have the level 5 going right down through to level 1. We are currently at level 3. And right throughout the whole lockdown process, up until very recently, they banned prohibited the sale of alcohol and tobacco products in South Africa. Now, this obviously, whilst I think had the best intentions, has caused absolute havoc amongst our very high consuming nation of alcohol drinkers. And, you know, this also has promoted, you know, more contraband, criminal elements, etc. So that's all just, you know, risen up. With people, and unfortunately making their own concoctions of alcohol and, you know, having deadly consequences. So there's also been a huge spike in the sale of illegal cigarettes, and yeah, so it's a very controversial and a very highly heated topic in South Africa right now. So, you know, with various policymakers fighting wars really with the government. So it'll be quite interesting to see the outcome there. Obviously, with the ban in alcohol came the huge spike as well of gender-based violence, because we've now got people going through withdrawal symptoms. They are, you know, in poorly ventilated, cramped shacks, you know, in the poorer areas. And I think within the first few days of lockdown, we had an increase of just in one call center, 2,300 cases just in a couple of days within, you know, level 5. So that was hugely, obviously, concerning. But what came out of the, and you know, I'm the kind of person, I love to focus on the positives. If anything, we had a tremendous call out. So I'm speaking from the Western Cape perspective, from the homeless sector community, just saying, you know, we've got all these homeless people that are now in lockdown camps, you know, being put into various lockdown camps and shelters. We are struggling in terms of the withdrawals. We don't know how to deal with it. Please help us. And it was quite an amazing thing. What we did was we put out a call to the entire substance sector forum, and a few of us jumped on board. And this is why it doesn't feel like for us that we've actually been in the lockdown process, because we've been pretty much out there in the front lines since the start of lockdown. But essentially what it did was allowed two sectors which have somehow evaded each other for all these years, which is essentially the homeless sector forum and the substance sector forum, to actually come together and create a beautiful collaboration of services, because, you know, we obviously all specialize in our respective fields. So what we did was we PPE'd ourselves up to the hilt. And we just got the bravest of, you know, the people that are, you know, registered professionals, because we are dealing obviously with the heroin withdrawals, alcohol withdrawals. So we had to partner with organizations that obviously specialize in opiate substitution therapy, and, you know, manage the methadone and Suboxone, etc. And so what we did was we said, right, guys, you know, let's just pull together, get around a table and see now who is able to do what, can do what. Let's not reinvent any wheels here. And let's create a process, a standard operating procedure between all of us in terms of, you know, the homeless shelter. There are two that we are piloting this at the moment, and that's also in partnership with the city, because, as you know, they had a big, there was a major controversy around the Strandfontein homeless camp for 2,500 people in Cape Town, where there were severe withdrawals, etc. And what happened with the Paint City camp was it was wonderful to actually see the city saying, you know what, could we please speak and have the professionals round the table because we need your input. And we were actually able to create this collaboration and a basket of services, which essentially goes from the medical through to the psychosocial support, because obviously, we took a trauma-informed approach because, I mean, the severe levels of trauma of the homeless population, I think, you know, nothing that none of us, you know, already know. But the trauma-informed approach where we could also train everybody from the guards at the gate to have a trauma-informed approach with dealing with the people. Everybody needs to understand their context and just have a heart and a feeling for that, and that it needed to be dealt with in a specific way. So that whole process is continuing at the moment, and we are addressing the barriers as they come up. Obviously we do get, some of the team members have had COVID and have had to, isolate, and, then we're down a few and then we're back up again. And, I would say overall, if you look at just the people in those particular contained spaces, they are 100 times better than they actually could have been before, because they've also had the opportunity now to be tested for their TB, HIV, other underlying conditions, etc. Because remember, they were forced to go in lockdown 5, but in lockdown 3, they have the freedom to go back out onto the streets. But the wonderful thing is that they're coming back into the shelters, into the camps, which is not normal. So it shows us, that there is something being done right. And, with this sort of straight through process of basket of services. So we'd like to run it through until, reintegration, which we all know is about a 2-year period, to really walk, a long line with a person. And that is obviously where the homeless sector and the civil society play a major role in the whole process. So that's, essentially our happy story. I'm glad I could share a happy one with you. And I'd be very happy to share as well any information on it, and and receive input and further ideas. And we're always just so we just can't do this alone, man. It takes a globe.
Certainly does. Thank you so much, Stacey. And I think that the increased access to care that you're talking about for these two populations that weren't working together is really inspiring and very hopeful for us. And it's really great to see that, something very positive is coming out of this current tragic situation that we have. And like you said, this having them come back to continue to receive those services and getting them those additional healthcare services is really going to be life-changing. So thank you so much for the front lines work you're doing and all these essential services. You're just wonderful. Thank you so much. So now we are moving to a short break with Carlton. He's going to put a few questions up there. Carlton, are you there?
I am, absolutely. So here's what I'd like to do. I want to inject, if I can, a little fun, if I can, with respect to this, but relevant to the conversations that we've been having. And so what I'd like you to do is in the chat box, I want you all to take this challenge. If this was a shirt, how many holes are you looking at? I'm only going to provide about 20 seconds for this, but put it in the chat box and we'll see the point that this makes.
So we have 6, 8, 4, 8, 8, 6, 8.
Right. So I don't know if we're all looking at the same shirt or not, but the correct answer is 8. And if you can follow along with me, for those of you who said it, if you're looking at this hole, that's actually 2 holes. There's a hole in the front and a hole in the back, so that's 2. There's a hole in the front and a hole in the back here, that's 4. We have the sleeves, that's 5 and 6. And then where most folks forget is that there's a hole here for your head, and there's a hole down here. And so that's a total of 8. And one of the reasons why I like utilizing this is because it's really, in my view, representative of a real understanding of a phrase that we have in our communities that says, if you can't see a problem or name a problem, you can't solve that problem, right? And so I want us, if you wouldn't mind, take a minute and I'd ask you to put in the chat box, how has COVID-19 impacted your ability to deliver prevention, treatment, and recovery efforts? We've heard a lot from our esteemed panelists, but I'm interested in hearing from those of you who are out in the field, how has it impacted your ability to deliver those services that are so crucial to our communities? And Chantel, we'll only take about 30 seconds or 60 seconds for this, but if you start to see some things, please share them.
Okay, I don't see anything yet.
They're typing.
A positive impact. We've been able to partner with our sister coalitions in the area to do live presentations online. Everyone feedback.
Terrific. We heard from Judy that there's impact with delivering services, and particularly treatment and recovery services in Kenya. I see here from Shasta, a good friend of ours here in the US, that we've had to adapt to a virtual outreach, and suddenly dealing with schools is a bit difficult and challenging. Difficulty reaching youth because of internet connections in the areas that they live. So there's a number of issues and challenges that we are all contending with here, right? So again, it's important for us to really be able to understand many of the complexities of these issues, and just wanting to hear from those of you who are out there on the front lines delivering prevention, treatment, and recovery services, what and how is this disease really impacting your capacity to deliver. Amy, I'm going to turn it back over to you so that we can go on towards some of our important presentations that's happening.
Perfect. And while you were doing that, I actually got ahead of the game and promoted 2 of our panelists.
Look at that.
So the next section, we are going to hear from a few countries in the Balkans region and then Italy. So first with us, I'm very pleased to have Boro, and Boro is from Celebrate Recovery. He's also the president of the Recovered Users Network. He's the WFAD board member representing Europe. And we're going to have him go first, and then we'll introduce his co-host, who's going to be talking about the region as well, Miuka. So we'll first have Boro.
Hello to all participants, and thank you, Amy, for organizing this kind of meeting that brings something that we are missing, and this is that feeling of connectiveness. And this is what we are for sure missing. We have it online, and we are hoping for a better future where we will see each other in person and have our fellowship together. Let me explain some things. Today is 17th of June, and we have now 3 months in Balkan region since COVID-19 outbreak started. Not all countries made a lockdown in the same date, but I think until the 1st of April, it was impossible to move from the country to a country, or even in some countries like in Croatia, you couldn't move from one region to the other. On the end, I don't want to speak now about a lot of numbers. You would, if it was a worst scenario, you would see it in your newspapers, even you are so far away. It wasn't worst scenario. I don't know why. Why we are still healthy enough. It was a lot of death cases, but still in comparing with Italy, Spain, and other parts of Europe, not so much. Now, as we have 3 months after, as we are really strange countries, we are doing all radical stuff or totally liberation of all measures. And now we have a really better time. Everything is open. People start to work from the offices. Of course, there is a structure that you cannot be more than 100 people in the same space, but normalization is seen everywhere in the way of openness of stores, shopping malls, etc., etc. But there is something deeply what is going down, and that is that the people through these 3 months are really somehow afraid to go out. You will see empty restaurants, you will see no willingness inside of people to travel, even they want to go. So that's difficult mixtures of that situation that produced in people. So, and when we are talking like that about globally, about people who are surrounding us, can we imagine what to talk about people who are using drugs or people in recovery? So basically, in our organization or our partners in the Balkans, we've been working all the time from the home or from the offices. After maybe 1.5 months, we started to work again from the offices. But what happened is that we asked several services what they are doing, treatment centers, detox departments. So basically, everything was locked down. So if you are a drug addict, you want to go to some detox department, it was impossible. If you are some person who are using drugs, you want to go to some rehabilitation center, it was impossible. So even all the social services that should provide some social support, it was locked down. So it was very complicated, I think, for the people who are using drugs to reach the services. Also, I think one chance was not used, and that's that addiction treatment services should be more somehow open to create the systems to lock more people in that difficult situation inside of system, and not to leave them to use drugs on the street. I don't know, I just have a feeling in this region it was much more opportunities to use through this time, through this 3 months period, but as everybody was without knowledge what to do, it's very understandable that it was not possible to do something better. So basically for the people in recovery, our experience is that we didn't have any new asking for coming and going into some recovery processes. So our telephone was not ringing at all. Maybe in some countries you could see, you know, that online interventions were bigger in the way of new people who are calling and asking for what should I do in this situation now. But in our 3 countries, Serbia, Montenegro, Bosnia and Herzegovina, was really, really less calls. But what we realize is that people who get some recovery service from us, like self-help groups, they like it to continue through the online. And what we also saw that parent support was bigger through the online period than it was before. Why? The people are normally on the job and they are always excusing to come to the self-help groups, like mothers cannot come, etc., etc. Now it was a just good atmosphere to provide some more information to them. And it was something that we could say, okay, online interventions are bringing something good. A little bit about just future in the Balkan region, what I'm thinking. So addiction, it is nowhere on agenda now. But basically, if you will start to raise some new actions on addiction, nobody will listen to you. I saw it through the, like, for example, there are some international days of this and this and this. It was no awareness about anything. It's everything on what is on agenda, it's COVID-19. So it will be very hard for us, for the NGO sector, to come inside and to raise awareness about addiction recovery, and what we can do, and what is everything following. Also, through this new normal, which is the word which I don't like and I don't want to use it. I was normal, and new normal is nothing. You know, we will be normal again. So I think that treatment and recovery services will start to work inside of the new standards, and this standard is keeping my institution safe. So wherever you go, you want to go in some hospital, you want to go to some doctor, wherever, you have new standards, and the standards not to bring a service and deliver it to a people. That is your main why you are there. The more is keep your institution safe. And there are thousands of rules how to do that. I'm a little bit concerned that through that treatment services and also rehabilitation and recovery services will lose this chime. This is connectedness, and this is spreading more hope, creating new identity. This is that meaningfulness activities. This is empowerment. So if we make our focus too much on standards and new normal, we will lose to look inside of people's needs. And the needs in the moment for the people who are using drugs and people in recovery are for sure much, much bigger than before. Because the uncertainty, we don't know what the future will bring to us. Yeah, everybody is saying about second wave, and you need to care about that and about that. So globalization and media making us crazy, you know. And really, it's hard to pronounce what will be in the future with a lot of services like that. For us who are working with the people in addiction, it's also very hard to make some recovery plans for the people. What kind of plans we can make in the moment? Like to say them, okay, let's do some education, and maybe on the labor market, you can be employed, because everything can be crashed and collapsed in the next day. So we are living in really difficult period how to deliver recovery services in the proper way, because we don't know how to plan our own lives, because everything stopped. So basically, we should somehow try to prepare for the future, somehow, because it will be in the whole world less job opportunities, less hope, and more mental health problem, more depression, more family violence, of course, more drugs for sure. And we should be prepared for that. And in my opinion, how I see the things here in Balkan region, more online and phone intervention should be available. But it should not end it in the online or phone interventions. Then it must have continuation in the person services. Because we can talk about that for hours, but the smile of Amy from the other side of the Zoom, and when I see her, for example, in Vienna, it has a different influence on each other communication and what we are doing. And we should not forget that. Online is good, everything is fine, but we should, if all the world stops, we are working on something special, you know, and we should make our efforts to bring our clients into our offices and speak with them and empower them to do something properly and to get on the proper recovery path. So basically more online on interventions and more continuation in-person services that will bring more connectedness. This is what I'm thinking, and what we will try to do somehow to provide services that you can catch us everywhere online, but online is not everything. So we need to meet in person and to create something. So basically, this is what I'm thinking in the moment. Would people recover in the future? It's a big question. I think yes, because you know where recovery happened. There is more need to be recovered. And your situation and depressions and this hard period in all persons start to create need. I want something more. So basically, I'm not afraid. People will come into the services, and through that need that is now inside of them, even bigger than before. Because this situation that doesn't allow us to go and to plan and to be happy, I think it will provide a real wish to go to the recovery path. So thank you. It was more a little bit of explanation, my thinking about current situation than some numbers, but I hope it helps.
Absolutely. I think what you said, and you voiced a lot of our frustrations. I think, you know, we are very encouraged by the online opportunities and the different virtual learning things, but at the same time, those can never replace our in-person meetings. And like you said, you know, being able to see all of you guys on camera here is wonderful and it fills my heart. But seeing you in person at C&D and at our global meetings, you know, is just a little bit more. So, you know, we need that one-on-one touch. And I agree with what you said also, that, you know, recovery is a need and a want that starts here inside each one of us, and you fulfill that need by your interpersonal relationships and the online trainings and things we can do. So it's not a one or other. We have to figure out how to make it all work together. And then so to continue on from there, we're going to ask Milka to join us, and I've unmuted you. Let me see. It looks like you're good to go.
Yes, thank you, Amy. And it's an absolute pleasure to join all of you in the seminar, and thank you for hosting these discussions, and hope all of you are well and healthy, and that your families haven't been harmed by this pandemic. And this pandemic is truly one of the most dangerous challenges we have faced in our lifetimes, and people affected by addiction and those also in recovery and their families were not exception. Moreover, these restrictions do not affect everybody equally. Particularly vulnerable are those experiencing also multiple disadvantages and coupled with drug addiction. But with schedules disrupted and medical and psychological care restricted and support networks shut down, the COVID pandemic has jeopardized individuals in recovery. And it's my belief that the most vulnerable, and among those especially women and children and young people, must be supported and equipped firstly by concrete life-saving services, as they are first and absolutely critical to save lives, but also let's not forget that the addiction and recovery do not stop with the pandemic. And in these conditions, with the disease emerging and having so quickly spread out through our countries, people in lockdown we had to strengthen the online and helpline services and tools, just like Boris said. And those of us who work in the field and who are on the front lines became concerned for people in addiction and recovery as the pandemic spread out. And also, as Boris said, social connections and support are key parts of recovery. Without them, relapse is also more likely to happen. And even more concerning is the fact that when people with, for example, opioid use disorders relapse, there's more involved than a loss of sobriety. Often there is a loss of life. I'll just continue with Boris' approach and talk about our services and what we have done. It's basically the number 3 topic in your agenda, and to bridge this gap in connection and apart from the free and anonymous helpline, we developed an online support group, and that didn't only provide a safe online space to share and socialize and get the support people need, but we also wanted to support social interactivity and also innovation. So we started a wonderful tool called Esperanto recovery board game. So this game was developed with and for people in recovery to support treatment and treatment of addiction, but also a very good tool for prevention of relapse. And it adopts an asset-based approach to recovery, where basically players and people in recovery have the opportunity to review their individual recovery plans and also to build their recovery capital. And this was a truly transforming thing for our group therapy sessions, and by making it highly interactive and client-focused. So the connections were very visible in the group. And also, with the change of this routine and coupled with unstructured free time, recovery was more difficult for many of those who are engaged in our services. And although the retention rates have been really stable, the stress and feelings of loneliness and frustration and hopelessness that those in very early recovery have experienced has really became a problem, and they left the program because the meeting forms felt like something chaotic and not the same. But for those who have been for months in our program, for a couple of months, they stayed, and this was a really very significant tool for them. So they stayed with online group and individual meetings. So this proved to be a very good tool. As far as the second topic is concerned and the impact of COVID on women and girls, it was substantial, and it included raisings in rates of domestic and intimate partner violence. And social distancing may have particularly been hard for survivors of gender-based violence. And they already have been economically dependent on their abuser. So the hotlines and the emergency services that are available in the Bosnia and also other two countries, Serbia and Montenegro, have been working during the lockdown, but they couldn't actually admit new people, new women. So in April, there was an increase by threefold in calls, which is very worrying. And in May, the numbers only decreased by 10%, and in spite of the looser restrictions. And the specialized services have been actually provided by 8 safe houses across the country, and they were providing social support, but as I said, new beneficiaries couldn't be admitted. So the large number of cases of violence have been linked exactly with addiction, which also adds to the fact that addiction doesn't really affect only the individuals, but families, women and children are very much affected. And I think that by putting some stronger measures in place, such as designating maybe shelters and hotlines in the countries and increase the support that is available for women and girls, must be something, a new step for the governments. And now more than ever, there is a need to send this strong message that violence cannot be tolerated. And I'm speaking also on behalf of my Women Gender Working Group of WFAD. And this is really the moment to push forward the strong message that addiction is really devastating and has the consequences on families and children. And this is also the same for the other 2 Balkan countries. So pretty much the similar situation. So I'll not take much of your time. And in conclusion, I wanted to just highlight that interpersonal connections remain at the core of recovery. And yes, as Boris said, online meetings are great and they play significant role in maintaining support for people in need during the pandemic, but they are far from universally helpful. So this is the data from us in Sarajevo and also from the Balkans. Thank you.
Thank you. Thank you so much. And thank you for, I think that the increase in partner and domestic violence has been mentioned many times. And I think that that's something that we really need to make sure that we are addressing as we move forward. It might have been something that we were looking at as part of all of these other issues, but now it seems to be rising to the top. And so thank you for your information on that.
Thank you.
definitely going to have to, put into effect. And I really love this board game, and I'm looking forward to hearing more about that and seeing if we can share that. That sounds like a lot of fun. I would like to play the board. Yes.
I will send you the links, and we can share with everybody who thinks it's useful.
Perfect. Great. Thank you. So next we have Slovenia. So we have Mate joining us. He is the director from the Institute of Research and Development, UTRIP, and he is also the vice chair of the Vienna NGO Committee. And I believe I've already promoted him to a panelist. So we should be ready to go, Mate. Let's see. Do I just need to unmute you? There you go.
I'm in. Do you hear me?
Yeah. Yep.
Thanks very much for invitation. It's great to be part of this huge, important event. And I think I have something to share, especially in the field of prevention. But, after listening to all the people from around the globe, I think Slovenia is a very lucky country. We are dealing with this situation in a very positive way. We are coming back to normal again, and we hope there won't be any second wave of this crisis soon or never. But we try to be ready also for any additional outbreaks in the future. Regarding situation, I must say that our government acted really strongly and early enough to prevent the spread of coronavirus. Especially, they declared pandemic already on 12th of March and immediately closed the border with Italy. Italy is one of the most affected country in the world. So having Italy so close, it was really crucial for us to close the border completely with Italians. And also our government declared the full lockdown. So we were pretty much limited to move within our own local communities. And I live in a very small community with maybe 2,000 people, so you can imagine there was not so much opportunity for me to travel around Slovenia. So we were really locked in our own small community, but also with very positive experience. So nothing to complain about this lockdown at all. And at the moment, we are really in good condition regarding this crisis. So I hope it will stay like this in the future as well. Regarding our own organization, we are mostly present in the field of prevention and advocacy. So that the two topics were crucial also for us in this period of crisis, especially in the field of prevention. We focused our activities based on the situation towards parents and parenting tips for parents, how to deal with these situations at home with children also in lockdown. So no schools, no kindergarten. So all the families stayed together at home. So we were trying to promote and disseminate as much parenting tips for parents as possible. We joined forces with UNODC and World Health Organization and many other organizations in this prevention dissemination activities, and we try to disseminate those parenting tips in social media, on websites, different interesting websites for parents. We use influencers, Instagram, many other channels to reach as many parents as possible, to give them some ideas how to deal with the situation. So this was pretty much a lot of work for us in this period. And of course, as soon as we found out what alcohol industry is doing in our country, there was a huge increase in online sale of alcohol, including door-to-door delivery, free door-to-door delivery, we immediately joined forces with some other NGOs in the field of public health and request the government to ban online sale of alcohol and door-to-door delivery, but we were unfortunately not very successful in this in these activities. But we tried to bring this important issue on the political agenda, and we hope this will be a good baseline also for our future activities in the field of alcohol policy. So we will not stop our work in this field. We will upgrade activities. We just published Slovenian translation of the book Heineken in Africa. We will have official presentation tomorrow with author from Netherlands, and we hope there will be some political attention as well towards this this important topic, and also in the future. Regarding the financial situation for NGOs, we were pretty much lucky as NGOs in the field of public health. We just signed the contracts, 3 years contracts with the Ministry of Health 1 or 2 days before pandemic was declared in our country. So we are pretty much on the safe side regarding funding until the end of 2022. So this issue is not on our agenda, fortunately, and we can work as we planned as much as we can in this situation. And of course, a lot of activities planned in our programs are planned to be organized as in-person, face-to-face meetings, trainings, etc. And those activities were all postponed to autumn. And we hope there won't be any second wave, because in the situation of second wave, we would be forced to move pretty much everything online. And we have some experience already with some meetings and trainings online. And we are also planning to adopt some school-based prevention programs and family-based prevention programs to do and to deliver at least some basic sessions online through Zoom or other platforms. So we are thinking about that, how to deal with similar situations in the future, because otherwise we will not be able to do a lot of school-based interventions or some family-based interventions as well, which are pretty much the core of our business. So we are thinking about possibilities how to move some basic interventions online for schools, for kids, for parents, and for families as a whole. So, but this is pretty much what we do, and we also have some. We are quite well informed what is going on in other services as well, so they were not so much affected. Also, risk and harm reduction services in Slovenia continued to work with some limitations, of course, regarding lockdown and delivery of equipment, and also treatment functioned to some extent as well. So also NGOs organize themselves to offer shelters for homeless drug addicts. So with some limitations, NGO sector is usually very innovative, flexible. So we always find a way how to help people in need. So that's what happened in Slovenia. So risk target groups and communities were not so much affected by this coronavirus pandemic, and hopefully it will come back to normal in the next couple of weeks and months without second wave. I think this is pretty much it from my point of view, and I will answer questions if there are some. Thank you.
Thank you, Mate. We will save those questions for the end, and thank you for all the work that you're doing in supporting prevention. And it's really been a pleasure to see all of the webinars that you've been participating in and really getting all of those online resources out there. So we're grateful for that. Next up, we have Italy. So we have Monica from San Patriano. I'm going to unmute And I believe she is already good to go. Sure. Oh, there we go.
Here I am. Hi, good morning, good afternoon, or good everything you have in your country where you are. And it's a pleasure to see you all from all around the world and discussing this important issue that affect our lives so much. So, well, I have to start saying that Italy was the first country, Western country, to be hit by this epidemic, this pandemic, let's say, and we paid a very high price to this first participation to this tragedy, let's say. Actually, at the beginning, the indications were not that clear, or better, the WHO gave us this indication that you should get tested only if you have at least 3 elements, that is high temperature, cough, and some contact with China. But of course, a few people had these 3 elements altogether, but they were affected by COVID, but they discovered it after days of high temperature. So in the meantime, they spread the virus around. So it was really a tragic beginning of this situation. We started to take care of people, to hospitalize them, to have intensive care for them, but there was no therapy, as you might know. So we had a lot of people dying, 34,000 people dying, with the first region affected, Lombardia, accounting for half of the total death of the whole country. So the situation was really difficult, but of course the reason was that nobody knew what to do actually. And the other country that followed us a few weeks later learned by, unfortunately, by our experience to act in a better way, but more quickly, because the sooner the diagnosis, the better the outcome of the patients, of course. Regarding our specific field, that is drug services, I have to say that the people that work in this area never stopped. So they continued to work, of course, as Matej said, with some limitation, but we tried to do our best to continue to assist people in needs and people who have the need of treatment, of recovery, of services. So the public services that normally are those in charge of providing, of distributing methadone and buprenorphine continued their work. The psychiatric and psychological services continue as much as possible online for those who were equipped with this. And the other worked at shelter for homeless addicts or something like that. Regarding the communities, as you might know, in Italy there are more than 600 therapeutic communities that welcome a very large number of people with drug use disorder, continued their work with people already resident, but unfortunately we were obliged to stop all the admission. At San Patrignano we stopped the admission a couple of weeks before the national measure was taken, because we were aware that if the virus entered the community, of course the problem would become not manageable, because we live all together 1,000 people, and so it would be really a mess if we had some cases of this virus. But we were lucky, and we were good in doing it. We were clever, and so we had not any reported cases. because we used all the possible measures to prevent the infection to enter. So we stopped admission, we stopped family visit, we stopped home visit with paid leaves. And so we do everything that was possible to avoid the contagion to enter the community. But of course, we were unable to welcome new people in need. So this was something that caused a suspension in the process of recovery of new people. Actually, in those periods during the lockdown, let's say 90 days in Italy, or a bit less than 90 days, we received a very small number of new requests. As well, there were a very small number of complaints from women for gender-based violence. I think that this was caused by the fact that everyone was locked into his house, her house, and it was impossible to reach out a solution. So the only thing to do is to adapt to the situation you had. So of course, this could turn out into something that Boris said after this lockdown, everything might explode. Many people, much more people will be in need of help for mental issue, for drug use disorder, for gender-based violence. Our kids also, as Linda said, have been strongly affected by this long lockdown in which they were obliged to stay at home. So everything need to be managed very, very carefully in order to go back to a new normal, because all these vulnerable population are going to be strongly affected. Not to mention the economic situation that, of course, in all your country, but in Italy too, is very bad, and it's not going to improve shortly. It will take a long time before we can go back to a good economic situation. What can I say more? Well, all the communities collected the request and the needs that they have, and we wrote a letter to the government in order to present the government our needs and the needs of the people that we take care of. Because actually during the period of lockdown and during the emergency that was so difficult in Italy, the sanitary system had to take care of the people with COVID issues, of the hospital with COVID, and everything was around this problem. So the problem, the drug issues were left on a corner, and nobody officially, the authority, the government, the local government didn't bother about this problem. We were clever enough, all the people that work in this area were clever enough to continue their work. But of course, without the support of the government now, it is difficult to go on and to continue, because the resources, both economic and the staff and everything, are getting short. So this is our situation now. We are doing our best, but of course it's not easy.
Thank you, Monica. Yes, we all started watching you in the beginning, and we've been learning from different things that you've been doing, and we're very glad to see that you're on the road to a recovery there. And we understand it's going to take a long time. So we're We're now moving to North and South America. So we have the US, Mexico, Argentina, and Colombia on the agenda. And that will be the rest of our countries. So our next person, I just have to find him. I've moved everybody to panelists already, is Dr. Sharif Moore from Drug Free America Foundation. He's our epidemiologist, and he is next. So Sharif, you're up.
Good morning. Am I live here? Hear me?
Yep, we can hear and see you.
Okay, great. So the US is a little unique in that by the time the coronavirus pandemic hit, we were already in the midst of a deadly epidemic of opioid use, which is now in what a lot of people in the field are calling the fourth wave. The first wave was with the prescription opioids in the early 2000s. And as the government tightened regulations around prescribing, organized crime groups moved in with heroin, which then shifted to the synthetic opioids. That was the third wave, fentanyl and its analogs. And now in this fourth wave, we're seeing synthetic opioids being used with stimulants, mostly methamphetamine. So really, with respect to substance use, this pandemic could not have hit at a worse time. The US leads the world in cases and deaths. I just had a look at the Johns Hopkins University dashboard, and according to their data, we have approximately 2.1 million confirmed cases and 117,000 deaths. After the pandemic hit, most of the country had shut down by early April, which led to the largest rise in unemployment in practically 100 years since the Great Depression. So the arrival of the COVID-19 pandemic, coupled with all the economic turmoil and fear and uncertainty that goes along with that, that just exacerbated this deadly opioid and substance abuse epidemic that we were already in. One of the restrictions, as in many other places, were these shelter-in-place orders, and what that did was push everybody into forced isolation, which understandably led to decreased access to prevention and treatment services, as well as healthy outlets, and activities that provide distraction from, the unhealthy coping mechanisms such as substance use. In addition to that, those that were on medication-assisted treatment for opioid use disorder, a lot of people were having problems getting their medication, or they didn't feel comfortable going. For those that were on methadone, they didn't feel comfortable going to the clinic because they, were afraid of being exposed to the virus. So all of that really increased risk of relapse and overdose for those with opioid use disorder or in recovery from opioid use. So all of that coupled with this stimulus checks that were sent out by the government, which was $1,200 per person and I believe $2,400 per family, that just basically amounted to a nationwide trigger, for substance use and relapse. Because you have all this fear and uncertainty surrounding the pandemic and the job market, coupled with this sudden infusion of cash from the government. So that probably resulted in many people who weren't, actually substance users. Perhaps they started using substances to cope for the very first time, or those who were occasional users, crossed that locus of control from occasional use to actual, substance use disorder. But I think really the ones that were hardest hit throughout all of this are the ones that are using opioids or in recovery from opioids. They're the ones that were most likely to overdose during a relapse due to diminished tolerance. And also because of the social distancing measures that were put in place, people were more likely to use alone. So whether you were coming back to opioid use, you're in recovery and you're relapsing, or you're an experienced user, you're more likely to if you overdose, you're more likely to die because you're more likely to be using it alone. And now the market has been flooded with these potent synthetic opioids like fentanyl and its analogs, some of which are 10,000 times more potent than morphine or 3,000 to 5,000 times more potent than heroin. So, and that's in fact what the public health data from around the country are showing. After the first wave of stimulus checks, after those hit in early April, close to 30 states reported a huge surge in opioid-related mortality, especially from fentanyl and fentanyl analogs. And that indicates that these synthetic opioids are still widely available despite border closures and these travel and other restrictions. And that's partly due to the ease with which it's smuggled through the mail. So there's already probably enough of it already stockpiled here in the United States ever since we shifted to the third wave and organized crime groups were importing it from China. There's already plenty here, I'm sure, to meet the nation's demand many times over. And it's still coming into the mail, in through the international post, because that's not really the probably the priority of the government right now, scrutinizing the mail as closely as it was before. So this really highlights the urgent need for greater access to prevention, treatment, and recovery. At this point, businesses are pretty much universally reopening with some restrictions, but we're starting, now that the economy is starting up again and businesses are reopening, we're starting to see reports of cases of COVID-19 rising again. So at this point, if the country doesn't begin to invest in solutions that can help heal the nation's isolation, pain, and suffering, we may be facing another preventable surge of deaths from drugs, alcohol, and suicide, which are the so-called deaths of despair, which always rise during times of uncertainty, especially economic turmoil. So just some of the solutions. In my mind, I see three main solutions. One, we need to integrate substance use prevention and treatment with COVID-19 response and recovery efforts. So as we create teams to test, track, and trace COVID-19 infections, we should also be testing, tracking, tracing, and treating patients and their family members suffering from or at risk of mental health and substance use disorders. And we need to make sure that those with opioid use disorder have access to medication-assisted treatment. The second solution is we need to get people facts. We need to educate people on the heightened risks to their mental health and the risks of substance use in the context of COVID-19, especially with respect to synthetic opioids. And we need to let them know where they can turn to for help. And third, we need to get people connected. This pandemic has created the greatest forced isolation in our modern history. So although we're physically distant, we have to make sure that we remain socially connected. Many faith and recovery communities are reinventing how their members can get together through online and virtual platforms. So we need to advocate for government policies and investment to help smaller groups that may not have the resources to build robust virtual platforms. They may not have the bandwidth or the internet access. Policies that support nonprofit organizations, faith and recovery communities, and smaller community groups to help build these kinds of networks can provide a lot of opportunities for people to get connected to others. That's pretty much all I have. Thank you, and I hope everybody stays healthy and well and safe.
Thank you, Sharif. Thank you for touching on something that I think is, as far as I know, pretty unique to the United States, and that was our stimulus checks that the majority of the population received, and how that has impacted the substance use world. And that's something unique to us that we're going to have to deal with, and the data will come out within the next 12 months on how each one of those waves of checks really impacted, especially the opioid use disorders. And now Carlton is
The
going.
challenge is because there's such a lag. You know, like our most current data on overdoses is from 2018, so that's one of our challenges.
Yeah, that's, you know, we're talking about this now, and it's something that we're going to have to make sure we're collecting data on, because some of these things we won't know for years. And Carlton is going to speak briefly on just some other issues that are happening in the U.S. or around this topic as well.
Yeah, thanks. And I want to add my thanks to Sharif for really a comprehensive and really critical kind of presentation of what's going on here in the States. What I want to do is I want to speak about a very specific aspect of it that we haven't talked about yet. And that is that COVID-19 is not impacting everyone equally here in the US. What COVID-19 has done, and if you all can recall the image of the holes in the shirt that I offered earlier, what's happening is that COVID-19 is revealing a good bit of holes in our health delivery systems and our support and help systems here in the US, and revealing some severe inequities that are occurring for many in our communities, and particularly communities of color. And so I just want to, and I asked Amy if I could share a one slide just to give you example of what it is that we are dealing with here in the US. As Sharif mentioned, the country was dealing and reeling from an opioid crisis, an opioid epidemic, even as COVID came upon us. And just as COVID came upon us, we were beginning to see a lot of data that showed that communities of color, and particularly African-American communities, were experiencing the highest rate and outpacing those of every other ethnic group with respect to the overdose deaths that were occurring as a result of involvement and engagement with opioids. That was before COVID. With COVID, what you can see here is that because of a variety of reasons, because of the fact that we are most likely not to have the kind of employment that will allow us to socially distance, to isolate ourselves, because of the fact that we are most likely to be engaged in those essential work efforts, because of the fact that we don't have access and inadequate access to the kind of health cares, and because of complications with respect to health in a disproportionate way in which that impacts African Americans. You can see here some really crucial data that shows that even while, for example, in the state of California, where Latinos represent only 39% of the population, they represented more than 45% of the COVID-related deaths. In North Carolina, where Blacks represented only 21% of the population, we represent more than 37% of COVID cases that are taking place there. You see the same in Washington, D.C., 45% of the population, but more than 59% of those COVID deaths. Louisiana is of particular note. Only 32% of the population there, African Americans represent, but they represent more than 70% of the deaths. I'm sharing this because the question for me really is around how and why aren't we protecting our most vulnerable populations, regardless of what the crisis du jour happens to be. We are dealing with the fact that far too many of the various structures and helpful systems within our society that we rely upon are failing some really crucial tests. They're failing the implicit bias test. They're failing the cultural humility test. They're failing the stigmatization test. The comorbidity of structural racism and implicit bias has led to a number of inequities, including income and food and health disparities that are overwhelmingly affecting the African American and other communities of color within our area. And so for us, I'll go back to what Amy shared earlier is that for us in prevention, we have to begin to think a bit outside of the box as we are engaging in our help and support. And if we're wanting to really try to address the real needs that are going on. In many cases, that means that we have to think and be more culturally appropriate with respect to the help supports that we are offering through our prevention, treatment, and recovery efforts. As Boro mentioned, we need to pay attention to the fact that for some cultures, the virtual meetings that we are engaging in is not something that is culturally conducive to the way we operate and engage. Communities that are used to hugging each other when you see each other and the like are having a very difficult time during this COVID-19 period, which is really impacting those that are out there trying to deliver help and services. There are a number of things that I can really reach into and speak to add to what Sharif has offered us, the foundation that he's provided. But I just wanted to give a picture that in the US, when you see those numbers, when you see more than 2 million cases, when you see over 117,000 deaths, they are disproportionately occupied by members of communities of color. And so that's a very important aspect that we as a society really need to pay attention to.
Absolutely. Thank you, Carlton. And that is, you know, we've brought up a couple things throughout our long webinar today of things that are outside of our normal box of prevention that we really need to start addressing. And, you know, these are probably things we should have been addressing from day one, but this crisis has really brought them to the forefront. So they're things that we can, you know, really need to challenge ourselves to be on top of. So next we have a report from Mexico. So we have with us Carmen Fernandez. She is the General Director of CIJ, and she is also the President of the National ISIP Chapter in Mexico. So welcome, Carmen, and let me make sure you are unmuted. I think you're good.
Yes. Thank you, Amy, for the invitation. It's a great opportunity to know about what's happening in each country. I am very happy that see everybody is healthy, and I hope your family also are healthy. In Mexico, we have many cases now of COVID-19. We have 150,000 confirmed cases. Unfortunately, we also have more than 18,000 deaths. We have been under the stay at home with all the recommendations, sanitary recommendations since middle of March. All the no-essential visits stopped for more than 2 months. Only the essential business like food, gas station, of course, drug stores and delivery food are opening. Hospitals, of course, and services, all services of health services like us. We made preventions and treatment and research and training about drug users, as you know. And now we open many kinds of psychological support by call and by internet. Talking about gender, we have a call services get psychological support, and we have seen a significant increase of women asking for support because domestic violence. 68% of requests of interventions are related to mental disorders, such domestic violence. Many others about stress, anxiety, and depressions. As you know, the WHO organization estimates an increase of 60% in pandemic, and in Mexico are reports that the domestic violence increased 70%. The emergency line, 911, has received more than 170,000 calls, and different centers of attention to violence in the country have registered almost 400,000 calls. Since we started to work at home, all preventing activities have been carried out online through various platforms and social media, development social emotional workshops for parents, youth forums, courses, trainings on various topics with the teachers, webinars for parents, and conversation between specialists. Next week, in the context of the International Day Against Drug Abuse, we will organize youth forums about listen, how to feel the young people. The objective is to know about the feelings of the youngers and give them psychological supports also. We are talking with many people about their emotions and how to control the emotions. We need to thinking about how everybody we will get adaptation to these situations. All centers stay open all the time. Outpatient care of drug users has not been interrupted, of course, with all sanitary recommendations. On the other hand, patients and their families have been motivated to continue their treatment through the internet and the use of different technologies. In March, April, and May, we are attending about 40,000 patients. Many people is attending. 36% of this population continues to be attended in person, and 64% by virtual channels. The most of them is treatment by internet. It is important to note that the care services were expanded to the open population, not only for substance users, also to people who had any symptoms of mental health, like stress, anxiety, depressions, many conditions, and post-traumatic stress also. Of course, the use drug is increasing. Alcohol is very increasing, and many other drugs, but marijuana and alcohol is the most of them increasing. We think that this situation, all this situation is a very good opportunity to join with many groups on young peoples and parents and many groups in the country. But it's a great opportunity to keep international cooperations. Of course, in person is better, but this panel that you are organized is a very good opportunity to know about all of countries, the situation of all countries. I am very happy to listen all of you. I hope you can share all this conversation, I don't know, by video or some report, but it is very interesting. Nice to see you.
Thank you so much, Carmen, and thank you for all the work you're doing in Mexico and really leading the charge there. And it's great to hear that you've been able to meet the challenges and remain out there for everybody to be helpful. And we definitely will be sharing all of this stuff. You'll just have to give me a couple days to put it all together. And next we have Roberto is joining us from Argentina, and he is the national chapter for ICE up there. And let me make sure that we have him ready to go. And Roberto, are you there?
Yes.
Perfect. We can see and hear you.
Thank you, Amy. Thank you, everyone. And I will comment about the situation in Argentina. In my country, we have quarantine since March 20. And we have 34,000 cases, 878 deaths, and 10,000 recovered. Since quarantine, as a series of economics and health measures have been implemented, and 2% of GDP has been allocated in the following measures. Increasing unemployment insurance benefits, subsidies for families without monetary income, specific credits for freelancers, and food assistance. The health strategy, it includes, first, an staged quarantine has been implemented for different regions of the country. Second, the health system has been strengthened with beds and respirators. And finally, the mass testing has begun, but they have started very late. About the specific drug problems, different studies describe the increase in drugs consumption. For example, the Buenos Aires University concludes in the general population, 45% admit to consuming more alcohol in quarantine. And the main reasons are the free time, emotional disturbance, no having a routine diary, and boredom. And another conclusion is the consumption of psychotropic drugs and marijuana has increased. So, about the drug problems, the following measures have been implemented. The Ministry of Health has made treatment protocols for treatment centers. Has regulated the electronic prescriptions and has regulated the online treatments. Finally, the challenges are especially in prevention and research. In prevention, I think it's necessary rethink strategies, universes, target populations, and channels. And in research, the incorporation of digital tools is a point very important. But rethink the samples design is too very important because the new context is no possibility for the same samples pre-pandemic. This is my very simple describe for my country. Thank you very much for the attention.
Thank you very much, Roberto. And Roberto did share a PowerPoint presentation that I will be able to share with you. I think an interesting thing that you just brought up that I actually didn't think of before, and I'm a little ashamed of it, is the challenges to research. You know, we do want to make sure that we have sustainability when it comes to how we capture data and research. And so for a lot of our surveys that we've been doing for years and years and years, if we have to collect that data in a different way, we might not have the same data sets to report out on. So it's going to be very hard for us to track overall trends and different things like that when it comes to the years as they go by. So it's something I didn't even think of. So thank you for bringing that up. So our final country, and certainly not least, and we're very happy to have her with us, we have Maria, and I'm probably not going to say this right, Echeverry, from Colombia, and she is with Debrand Cocaine. So I think you are all set to go.
Thank you so much, Amy, and thank you. It's so wonderful to hear from all of you and to have been included in this incredible panel. It's actually quite timely for us for a few reasons, but I want to start with a quick introduction because we are a bit different from a lot of you guys and the work that you're doing. So we are a newer initiative. We're called Debrand Cocaine. We are based between Bogota here in Colombia and in New York City. And we basically were formed, my sister and I, her name is Rafaela, we have a background in marketing and communication and more creativity. She's a graphic designer, I'm a creative director. And we came up with this idea about a year and a half ago, but we've been in operations now, I would say, for about 6 months. To try to approach the issue of specifically cocaine in a very unique way, having come from Colombia and having seen all of the money and the resources that have been spent on eradication and attacking the supply of this drug, we wanted to see if maybe we could mimic some of the social movements that we've seen online, both around products and causes that have really taken off as a consequence, I think, in large part of social media. And having this new generation, this new Gen Z generation that's rising, that's much more aware and have been exposed their whole lives to a lot of these issues. And see if we could use the momentum of those movements. So for example, what was done with ivory, what was done with plastic, what was done with straws specifically in plastic, the way people are attacking meat, the way people have changed their mind about tanning and the sun, all of this knowledge that's opened, and you have this new consumer that's thinking that they want to be ethical and sustainable in everything that they do, not just the food that they eat, but the clothes that they wear and the people that they follow on Instagram and Twitter and the social movements that they adhere to and also are joining. So considering that cocaine specifically affects our region so much, and by our region, I'm saying the Andean region because coca leaves are only grown in 3 countries, Bolivia, Peru, and Colombia. And then also the distribution goes out through all of Latin America. So we've seen the violence that was so native to our country in Colombia spread to Central America, the Caribbean, and then also through Brazil out. And then we've seen the same mirror in Africa as the drug goes up through Africa and then out through Europe. Can we start to change the view of cocaine around the world and get people to see it as this non-sexy, non-glamorous drug and really see it for what it is, which is an incredibly destructive product that does a lot of damage to people and planet. So that's a quick summation of what it is that we're trying to do. We're very early on in the process, and COVID for us has been obviously a challenge because we were in the middle of getting off the ground and meeting partners and fundraising. So apart from the obvious, what we've done, well, I want to give you a little bit of statistics just on Colombia since everyone has shared. Colombia went into lockdown quite early, about the middle of March, beginning of March, and it's been a very strict lockdown. I think that it's been interesting to see how the population has reacted to it. I think Colombia is a country that has, our citizens have, we understand this history of violence, and the idea of lockdowns for general public safety are actually quite known here and something that unfortunately we've had to do in the past. So I think people adjusted to it initially, at least in terms of sort of like a mental, emotional approach, quite well. Economically, it's been very devastating for vulnerable populations, and there's been a lot of efforts to try to alleviate that as best we can. But I think, ¿cuánto? we've lost 5 million jobs, is sort of where the numbers are right now. We have about 55,000 cases, and 1,800 deaths. So the death rate is not too high, but I think we were able to get prepared and have our medical, our healthcare and medical services sort of know what was coming. We're a high traffic country, sort of where we are situated geographically. In terms of our work, right now, we, unlike a lot of you, are not working so much in direct contact with users, and we are very much in the research phase. So what Amy, you just mentioned about the research is sort of one of the biggest issues that we're seeing. Once COVID hit, we sort of paused and thought, okay, well, our strategy is to think about the trends that are happening in the world and how we can always link those back to cocaine specific to this drug. And I know most of you work with poly users, and of course for treatment, that's very important. But since ours is more of a media campaign and more about marketing, we really want to understand the specifics of this drug. So we started trying to figure out, well, it seems like this is a drug that would be quite affected by this, as it is more of a party and social drug. So we've been trying to see if we can figure out a way to gather a little bit more data on how use has changed in terms of cocaine specifically. That's been trickier to find. We found some anecdotal research. We found some articles written by people saying they've moved back home, social isolation, spending more time with their family has made them realize that that was a drug they were using too much. But really the hard data is hard to find. What we have been able to find numbers on in the last couple of weeks, which is nice. Well, I mean, nice to have the numbers, not what's happening, is an understanding of what's happening in terms of production. So the Washington Post had a great article that came out a few days ago, and coca leaf production has, I don't know if the production has gone down as much, but the price has plummeted. It's gone down 73%. They're calling it the great coca crash of the century. Specifically in Peru and Bolivia, the prices have gone down. The political situations in all three countries are very different. But we're seeing that eradication has continued in Colombia. In Peru, I think not as much. And in Bolivia, I don't think that they do eradication quite as heavily. But we have seen that the price of the coca leaf has plummeted. We've also tried to track because for us, the supply chain is very important as well. So what's going on in the countries that it's traveling through, and how are we seeing? So we've seen that there have been an increase in seizures in some places at the beginning of the crisis. So in Belgium and some of the northern ports in Europe, they saw the raids produced bigger yields. So it seemed as the traffickers were trying to stockpile before everything closed down. And then in Brazil going out, they've seen a decrease in seizures, which is really how that's measured. And that's maybe not quite as accurate as we'd like, but I think that's what we have. And then finally, the last thing is looking at something Sharif said, which is I think the mail has continued to go, and so you've seen that opioids are still able to move around. Cocaine is mostly trafficked through the sea, and that hasn't slowed down as much as air travel. So they're seeing that potentially the trafficking didn't go down as much as they thought that it would, specific to this drug. So I think in terms of that's a basic kind of summary of what we have been working on. I would love to ask out to the group, to any of you, if any of you have any resources or contacts or anything that might highlight what has been the trend specific to this drug. The last thing I should mention is that we're also tracking, because cocaine is higher on the spectrum in terms of price ranges. We have seen that in the past, when there have been crashes, economic crashes, the consumption of cocaine specifically has tended to go down. In Italy, that happened after 2008, Italy being one of the higher consuming countries. So, so we're just trying to work with numbers to see how we can try to maybe put together some sort of digital small campaign that tells the story of COVID, and potentially maybe tap into this heightened sense of awareness of health, where we can say, you know, suddenly everyone's not shaking hands and they're using Purell and they're washing their hands. If when life resumes, if you think about sort of the many risks that you have in terms of contracting diseases through the way that you use cocaine, maybe people will think twice. And then finally, Carlton, I know I said it finally like 9 times. To your point, we are, we've been really inspired by everything that's happened, looking at how this COVID crisis has disproportionately affected communities of color, and looking at the protests and everything that's happening in the United States, and getting people that are really engaged in this history. How can we use the history of this drug, you know, the crack versus cocaine fight that happened so strongly, going back to the crack epidemic, and just saying to people, you know, if you really are supporting these communities, these vulnerable communities, communities of color, every time you use this drug, you're really hurting them even today. So that's part of our messaging. We've just launched our social media, kind of a soft launch, and yeah, any feedback, questions, we'd love to hear it. So sorry if that was a little long. Thanks, Amy.
Oh, that's perfect. Maria, is it okay if I share your email then with the group as a follow-up?
Yeah, absolutely. But actually we're switching over. We're switching from dbrand cocaine to dbrand.org. I'll send you the new one just so everyone has our updated one.
Okay, perfect. So if you can get me that in the next couple of days, I'll make sure that that's included into the report, because I do see in the comments section, there have been in the chat, it looks like Bangladesh has some information on the way that cocaine is routed through their country and stuff. So you might have some good context.
Interesting. And so much of what we want to do is really around storytelling and narratives. We're trying to get a group of young Latin American storytellers. We have some contacts in Mexico, and we're trying to get as many people as we can to kind of invest in this story and tell, you know, there's that great quote that one death is a tragedy, 1,000 deaths is a statistic. So in still using the numbers, trying to kind of put human faces and names to the supply chain and all of the stories that go along with this drug, to see if we can truly debrand it and get people to hopefully think of it differently.
Perfect. All right. Well, thank you so much for your report and for joining us, and for being one of the newest members of our global community. We're very happy to have you, and looking forward to collaborating and sharing in your success, because I know that you're definitely going to make a difference out there. So I think that this has been the longest webinar ever. And we have all of our countries reported out. So I think that Chantel has been kind of keeping track of questions there. What we're going to do is kind of review through those questions, see if we can find, you know, some answers for everybody. And then as a follow-up to the call, we'll be sending you, you know, a link to the recording, some resources that we've just been kind of compiling over the last couple months that are relevant to this, some new resources that anybody wants to send, and some that you have already sent, and just some follow-up information. And then, so really to just close, you know, we've not everybody is still on, but we still have a good amount of people on. Many of you are members of World Federation Against Drugs. Many of you are members of ISIP. I've seen a lot of you at C&D and part of our global conferences and our communications. But for some of you, this is probably the first time you've ever heard of C&D and the Vienna NGO and ISIP and WFAD. So your voices need it. We need, if anything we've learned today, it's, you know, listening to how these, how this issue has had impacts all over the globe. You know, each one of our voices is needed. So we encourage you, if you're not members of ISIP, if you're not members of WFAD, if you haven't participated in C&D, if you're not an NGO that is part of the Vienna NGO committee, please contact me. I'm happy to give you information on all of those organizations and let you know how to join, so that you can be a part of our bigger global task force, and just so that we can keep this conversation going. And then lastly, just thank you to everybody who stuck with us for the last couple hours. This has been so long. I think I got like a half hour of sleep last night. I was so stressed on how this would go over, and I think that it went well. I have to say that I reached out to all of you thinking that maybe only a handful of you would want to participate. So the fact that you all wanted to have your voice heard and were eager to learn what each other's doing really just shows that there is this need for coming together globally. And I'm just so happy to have you as part of our global family. So I will let you go on with your mornings, your evenings, your night times, and have a rest of the day, a beautiful one, and stay healthy and safe. And we will be in contact very soon. And also I can't forget to thank Carlton for co-hosting with me this flight that was a little turbulent, but we got through it. All right, guys, have a great rest of the day. Thank you so much. Bye-bye.